The MV Hospital for Diabetes in Royapuram was started by Professor M. Vishwanathan, my father, and also by Dr. G. Jaising, who was a surgeon who was working along with him. The MV Hospital for Diabetes has grown over the years into an internationally known center for research, education, and training for diabetology. The Professor M. Vishwanathan Diabetes Research Center was started by Professor M. Vishwanathan in 1972, and it is recognized by the Department of Scientific and Industrial Research, Government of India, since 1972. Now, the Research Institute does research in primary prevention of diabetes, that is preventing diabetes among the children of people with diabetes. It does research in diabetic foot disease, diabetic kidney disease, epidemiology of diabetes, and in many other fields of diabetes. Diabetes Research Center was started by Professor M. Vishwanathan to do research, and we publish more than 100 papers every year in peer-reviewed journals to encourage research in India, especially in the field of diabetology. So DFoot International is a worldwide body, and I'm happy to be the first non-European president of DFoot International, which is based in Belgium. The International Working Group on Diabetic Foot, IWGDF, produces guidelines for the whole world every 4 years. These are guidelines which are followed all over the world and are translated into various languages across the world. And everybody in the world tries to follow these guidelines. I have been very fortunate that I have been selected to be in this IWGDF guidelines from India for wound healing and offloading of the diabetic foot. One of the main problems with people with diabetes is they lose their limbs. They get infection in the foot and they have an amputation. So about 30 years ago, we started the MV Center for Podiatry and Foot Care with the aim to prevent amputation. So what we do here is we treat people with foot infection with the aim of preventing an amputation of the lower limb. Amputation of the toes, amputation of the legs, below knee amputation, above knee amputation. We try to avoid all this type of amputations, because losing a leg is very problematic in a person with diabetes. So the main aim of this center is to prevent amputation and to look after people who have infection in their feet or who have what is called diabetic foot ulcer. We have an excellent team, a multidisciplinary team, a podiatrics, his own team of radiologists and other surgeons available and podiatry staff available, and all of them have one motive: somehow we have to prevent amputation in people with diabetes. So we treat diabetic foot infection appropriately in order to prevent an amputation. This is the aim of the MV Center for Foot Care and Podiatry, which we started 30 years ago. Greetings from MV Diabetes, where a legacy of 70 years stands as a testament to our commitment to your well-being. With vibrant hues of blue and yellow, we paint a canvas of trust, positivity, and compassion, the heart of our care. Our rebranding isn't just a change, it's an evolution. Our comprehensive diabetic foot care, from prevention to post-surgical treatment, is backed by advanced treatment like hyperbaric oxygen and ozone therapy. This heart isn't just a symbol, it's a promise to a journey alongside you towards a healthier and happier you. MV Diabetes embraces modernity while preserving the quality you have always trusted. We are dedicated to your wellness today and for generations to come.
Hello and welcome to all to this edition of the Hindu Wellness Webinar. presented by MV Diabetes Hospital in Chennai and Bengaluru on the eve of World Health Day tomorrow. I'm your host, Shoma Basu, Senior Deputy Editor with The Hindu, and the panel today will look at how to unlock happy and healthy living. Health and happiness are two sides of the same coin, and don't we all know, realize, and understand that our physical and mental health is linked to good health? Yet, we often fall prey to false or unverified information that tell us how to become a healthier and happier version of ourselves by practicing often unscientific things. Today, the top causes of poor health are obesity and overweight, cardiovascular diseases, problems of the kidney, liver cirrhosis, diabetes, stress and anxiety, and much more. The different diseases may or may not be treatable, curable, or reversible, but individuals can maintain and enhance their well being. Our panelists today will tell us exactly how to focus on yourself for a healthier and a happier you. We have Dr. Vijay Vishwanathan, the head and chief physician of MV Diabetes at Raipuram, Adyar, and Vellacheri in Chennai, and Koramangala in Bengaluru. He acquired the skills and knowledge in the field from his late father, Dr. M. Vishwanathan. Dr. Vijay has completed 32 years as a diabetologist, doing extensive research work in the field of prevention of diabetic complications. A recipient of the first Vivian Fonseca Award from the American Diabetes Association for his research paper on diabetes and TB in 2013, Dr. Vijay has to his credit more than 250 original research papers published in peer-reviewed journals. He was the chairman of Association of Physicians, Tamil Nadu State Chapter in 2010-2011. He was the first non-European president of the DFOOT International headquartered in Belgium. He served as the National Vice President of the Research Society for Study of Diabetes in India from 2019 to 2022 and became the chairman of its Tamil Nadu chapter in 2023. And now he has been elected the RSSDI National President for the year 24-25. Dr. Vijay worries over the fact that every 10th person in the world today is a diabetic. And thanks to the misinformation freely available on social media, people perhaps think that diabetes is reversible. To clear myths and to reiterate some vital points, Dr. Vijay will give a presentation on reversibility of diabetes and steps to be taken for a healthy and happier life for individuals with diabetes. He will be joined by our second panelist, Vaishnavi Vijay, head of Mind Wellness Clinic, to add to the discussion on how good sleep and good food and so many other things can help to improve our health, and the comprehensive services that she offers at the Wellness Clinic in this regard. Vaishnavi is a clinical psychologist and an expressive arts therapist who has gained valuable experience working in prominent institutes, including the Banyan Academy of Leadership in Mental Health and Kanchi Kamakoti Hospital. A Bachelor of Science from MOP Vaishnav College for Women, she completed her master's degree in clinical psychology from Sri Ramachandra Institute of Higher Education and Research in 2022. So it's over to you, to both of you, Dr. Vijay and Vaishnavi, for your presentations.
Thank you, Dr. Ms. Soma Basu, for this nice introduction. I think it's important why we are doing this for World Health Day. The first point is the people with diabetes, the moment you pronounce that they have diabetes, they are literally scared that they will lose their kidney, they lose their eyes or heart or their limbs. So the entire next, say, 10 minutes or 12 minutes, 6 minutes for me and 6 minutes for Vaishnavi, are going to be just showing that people with diabetes can have a healthier, as the words above you say, a healthier and happier you. You can be healthy and you can be happy if you have diabetes. So this is the entire the idea of the entire program webinar, that if you are a person living with diabetes, the diabetic has been removed by the International Diabetic Federation, and now we say people living with PLWD. So you don't say you don't use the word uh, diabetic anymore. You are a person or people living with diabetes. So let me go on straight to the my presentation, which will, after 4 minutes, you have to stop me if I have exceeded the time. So we have to empower health. That is, we have to, I'll go on to the full screen. You have to empower health. You have to take steps, which I'm going to highlight for a happy life with diabetes. So once you become a person with person living with diabetes, there's nothing to worry. However, the International Diabetes Federation, this is from the IDF Atlas, which shows that the number of people with diabetes is going to increase exponentially, especially uh, in the Southeast Asian region. So you can see India and China are going to see the maximum increase in the prevalence of diabetes, which is quite worrying to all of us. So in every family, there will be a person with diabetes, living with diabetes. And this was one of the themes in the previous World Diabetes Day. Now, diabetes is often described as a vascular disease. It affects your retina, it affects your kidneys, it affects the brain, the heart, the nerves in the feet, if you're not careful, if you do not listen and keep your diabetes under control. So this is not inevitable, but it can happen in a person living with diabetes. Retinopathy is people, when you tell that you want to have their eyes examined, retina examined, they say, my eyesight is perfectly normal. But you can have changes in the retina, which can be quite unnoticed unless you unless you examine the eyes, you can't know that there are leakages of the blood vessels and so on. Now, a word about how diabetes comes. Diabetes just doesn't come out of the blue as you think it is. It doesn't happen just like it doesn't happen like a bolt from the blue. There is an unhealthy lifestyle and environmental factors, especially obesity, and obesity around the abdomen, which translates to fat inside the viscera, inside the organs, near the organs. The fatty liver is one example, and in the intestines there is fat. So this fat leads to a condition called insulin resistance, and there is increased cardiovascular risk, hyperglycemia, and type 2 diabetes. So you can see that it doesn't happen like a bolt from the blue. It happens if you have an unhealthy lifestyle, environmental factors, plus the genetic factor. If your parents have diabetes, you have a greater propensity to get diabetes. Now, diabetes starts here somewhere. You can see the point zero, but this is when it is diagnosed that you go to a laboratory or to a doctor and you find up your blood sugar is 200, 250, 300, whatever. But just imagine that situation that 5 to 10 years before the actual diagnosis, the abnormality has started, the biochemical changes have started. The insulin resistance is going up. As you can see, the insulin secretion starts decreasing by the time the diabetes is detected. Insulin resistance, which is shown in the red color, goes up. And you see the complications. Complications of macrovascular disease pertaining to the brain and heart and the feet, the blood circulation, the feet actually starts even before diabetes. And microvascular complications pertaining to the kidney and the foot also start at least 5 years before you diagnose diabetes. Therefore, you can prevent diabetes. You can prevent the stage with complications and prevent death, premature death, morbidity, if you're careful. If you diagnose pre-diabetes, about which I showed you in the previous slide, you can detect biochemical abnormality. You need not wait to become a person living with diabetes. You can actually prevent it by detecting it earlier. So this is called primary prevention. And secondary prevention is where get diabetes and you prevent the complications. And tertiary prevention is when you get the complications, you prevent it from getting worse and you die of diabetic condition. Now, the diabetes, what the American Diabetes Association and the European Association for Study of Diabetes say is that it is not just blood sugar that matters. It is the other comorbid conditions matters, the cholesterol, hypertension, the smoking history, genetic predisposition. So everything is taken into consideration. And you can, by walking, simple walking, you can actually reduce the complications. You can reduce the insulin resistance and have your insulin work better. And if you walk for about 5 to 10 minutes, your creative thinking improves. If you walk for 30 minutes after meals, it will help you to lose weight. So people who are wanting to lose weight, just walk for 30 minutes after meals. If you walk for 40 minutes, you can reduce the risk of developing heart disease in the elderly and so on and so forth. So you can actually, and if you walk 5 minutes, just 5 minutes, your mood improves. So these are the benefits of walking, after meals and so on. Now, I would like to conclude this small presentation by saying previously we were thinking of HbA1c fasting and postprandial glucose. But today we have a new concept called glycemic variability. That is, I will explain to you what it is. So HbA1c alone is not sufficient to make a diagnosis of this is in people who already have diabetes. Don't think this is for people who do not have diabetes. This is for people who have diabetes. HbA1c alone may not be sufficient. Now, there is a concept of TIR, and this is the green color. You should be more than 70%. TIR is the number of minutes you are within the range 70 to 80. If you fix up the range as 70 to 80 milligrams per deciliter blood sugar, it is the percentage of time you are in the target range. So more than 70 is ideal. So this is called TIR, or time in range concept. You can see this is an example of a person. I hope his name is not clear. It is, you can see that TIR is less than 70. So this is not good at all. And some days it's 0%, which is very bad. And lastly, I would like to mention what is glycemic variability. So HbA1c gives you an average of 3 months, whereas glycemic variability is something which gives you within the day, intraday or interday variation. Within one day or within the same day, morning to evening, it can vary. So intraday, interday variability is called glycemic variability. I think nutrition, you need not worry. My father, late Professor M. Vishwanathan, used to say that the person with diabetes should eat what the others in the family are eating. It should not be a special cook for special kitchen for somebody with diabetes. Somebody with diabetes should eat a balanced diet. Everybody else in the family should also eat a balanced diet. So, and also, remember that these extra calories which you eat in the evening at 5 o'clock, morning at 11 o'clock, adds to the calories, and it can lead to fat accumulation. And the person you saw with a big tummy can happen if you eat too much of in between meals, unhealthy food in between meals. So I'll stop here and ask Vaishnavi to talk. Ms. Vaishnavi Vijay, we can just talk about memory and sleep, and then we'll take questions.
So today I'll be talking about two very important topics, one being sleep and the other being memory. And lastly, I'll conclude with what we do at the Mind Wellness Clinic at our hospital. Next slide, please. So we all know sleep, and the quality of sleep that each person has is very detrimental to our health, not only to our physical health, but also to our mental well-being and mental health. Next slide. So first, when we talk about sleep, we have to understand the science behind sleep so as to understand how to go to bed on time. So there are actually two stages that sleep works in. The first being non-rapid eye movement and the second being REM, which is rapid eye movement. And rapid eye movement is usually the fourth stage of sleep where we begin to dream. As you can see in the picture, we're dreaming. And deep sleep occurs after that, which is after REM, we go back to non-REM sleep again and we begin to go into deep sleep. Now, we know it plays a vital role in providing us the restoration that's required so that you can begin your next morning feeling refreshed and not groggy. And also, its importance in cognitive functioning. Cognitive functioning is our thoughts and the thinking which helps you to begin your day and act your day. All of it is cognitive functioning. Next slide. So, sleep and physical health. If you do not have proper sleep, nothing in your body will work right. You'll be hungry more often. If you have not had a good night's sleep, you'll find that the next day you're hungrier than usual. Your immune system will not work as well. Your metabolism will become poor, and your inflammation in the body. Suppose you're somebody who works out a lot. The next morning, you need to recover from your workout in order to do it again and again. If there is inflammation in your body, you're not going to be able to do that. Next slide. So its impact on mental well-being, as I said, is also going to be a large amount, but we don't realize it as much. When it's physical, we tend to notice it, but when it's mental, we tend to ignore it. So sleep has a profound effect on how we manage our stress, how we're able to manage and regulate our moods, our emotions, and that's why it's important to have those 6 to 7 hours of good sleep as an adult. Next slide. So we spoke so much about its effects on our body and on our mind. So how can we bring about these changes? It is to incorporate sleep hygiene, something that's called sleep hygiene. That is, go to bed on the same time every single day. If it's 10 p.m., go to bed at 10 p.m. every single day. Be consistent with it. Create a bedtime routine. Maybe you journal your thoughts and then you go to bed. Create effective strategies so that your sleep can become more consistent, because if it's not consistent, then you won't be able to follow it. Next slide. So that is the conclusion of sleep. We've seen how the science behind sleep, we've seen how it affects us physically, mentally, and what we can do in order to prevent these complications. Next slide. So the next slide is about memory. When we're talking about memory, we have to realize that it's the most active system we have, and it is a system through which we receive information that is processed in a manner in which our brain can understand, and therefore the information that is received and stored in our body or in our brain can later on be retrieved whenever necessary. When we're talking about memory, it's also important to understand the different processes that are involved in memory, which is very simple to understand. Encoding is you put in information and that information stays with you. This can be information that's new to you, you're trying to make meaning of it, or it can be something you want to rehearse again. For example, if you're studying for an exam, you've encoded information and you're trying to read it again and again, so it's stored. Second one is storage. We do storage in order to maintain the information that we've just put into our brain, and our brain is trying to process it, and we store it right there. Here it stays for about 20 to 30 seconds. Unless you're trying to rehearse it, it really doesn't stay in storage. Next is retrieval. Retrieval is where most individuals have problem. That's when you have problems with retrieval is when forgetfulness happens. So retrieval usually occurs when you are not able to remember long-term memory or short-term memory, something that you stored in your short-term or long-term memory, then retrieval issues happen. And when we talk about types of memory, we have sensory memory. That is, like I told you, we process information. Ideally, the first process is to bring it through our senses, which is our eyes, our ears. When you hear a sound, there's something called transduction that takes place, and your brain is trying to process that and tell you this is the sound that you're hearing. Maybe it's a loud unpleasant noise, and that's what the sensory memory is for. Next slide. So in the sensory memory, it is very short. It doesn't last. However, even if the stimulus has ended, you'll still remember it. And short-term memory is interchangeably called the working memory. It is the memory where most of the information is temporarily stored. For example, you go to a class, you're listening to the class, and you come back. You remember that information for about 20-30 seconds, and then you're just blank after that. You don't know what you just learned. So that's what happens in short-term memory. Next slide. The most important of them all is the long-term memory, which is the continuing storage of information that happens, which is largely outside of our awareness because we're not realized this is still there until we're asked to retrieve it. So forgetting, as I told you, when the individuals have difficulty with retrieval, that's when forgetting happens. And age-related forgetting is very common since people tend to have certain sort of cognitive decline as they grow older. However, if that cognitive decline is too much, then it is something where you address the problem. It could be because of another comorbid condition like an Alzheimer's disease or dementia, but it is important for us to use tools and identify it at that particular moment. Next slide. So the memory testing that we do here is called the mini-cog. We employ people who are ages 60 and above to test them for cognitive impairment. And you can rapidly test their short-term memory deficits and any cognitive inabilities that they're having or any impairment that they're having. The mini-cog consists of two tests. The first one being you tell them 3 words and then they're asked to immediately recall those words. They're asked to remember those words. While they do this, they also do a second activity, which is a clock drawing test. They're given a specific time and they're asked to mark the hands of the clock. And this is useful in understanding their executive functioning and their visual motor skills and whether that's still intact. And yeah, next slide. So what do we do at the Mind Wellness Clinic here? It is Asia's first mind-related clinic in a diabetes center. We do all types of psychological counseling in people living with diabetes, and we conduct separate counseling sessions for children with type 1 diabetes and their parents. We give them 2 scales, one for anxiety and one for well-being. And if we find that the scores are concerning, then we give them counseling. We also providing psychological support or counseling to those who have elevated HbA1c levels. And we're also, we've performed this as a study as well, where we're doing PMR, which is progressive muscle relaxation and mindfulness-based stress reduction for patients whose blood sugar levels are out of control, or if they're just generally stressed by living with diabetes, since it can cause a lot of stress. Thank you.
Thank you, Dr. Vijay and Vaishnavi, for your valuable inputs. I would like to go back to your presentation, Dr. Vijay, and you did mention that diabetes is perhaps preventable if we kind of take enough precautions, if we do, and especially if the person is in a pre-diabetes stage. But obvious question which everybody wants to know is whether diabetes is reversible, because India is known as the diabetes capital. You have mentioned it in your previous programs also. So do you think that people really understand that diabetes is a serious disease and not just a simple disorder? And how a deadly condition like diabetes is an outcome of an unhealthy sedentary lifestyle, poor eating habits? So, I mean, where is that gap? How do we kind of make our population aware?
So, thank you. Good question, Ms. Soma Basu. The thing is, diabetes is a very serious disorder. First statement. It's a very serious disorder. I told you it's a vascular It is disease. It's a vascular disease. It's a disease. But at the same time, it can be a disorder if you take enough care about it. If you do regular, we're not telling you to do anything out of the box. We're telling you to do regular exercise, control your diet, have a balanced diet, which everybody in the family eats. And once you become diabetic, we tell you to do a blood sugar testing once in a while, which has gone off the fashion nowadays. We have the patch which can measure the sugar level. I showed GV, glycemic variability. So you don't have to even poke your finger. So it's become very simple to manage diabetes today. But people do not want, people want to eat sweets. There was a patient who came to me 2 days ago and said he wants a sweet for breakfast every day. He cannot live without taking that sweet. Now that's a bad thing. If he wants a sweet every day, if he says once a week I take a sweet, it's fine. So I think it's wrong to adopt unhealthy practices. You have to adopt healthy practices, and you should do regular exercise. That's all we are asking you to do, nothing else. So if you don't do that, if you keep your diabetes under uncontrolled levels, then you are asking for trouble. So
I think adopting healthy practices are always easier said than done. But we have to keep hammering the message so that people get it. We'll briefly go back to what Vaishnavi said. You mostly referred to sleep. So I was, while you were talking, I was just thinking, many times when we go to doctors as patients, they also advise us to rest well, eat well, sleep well, because especially sleep during those sleeping hours, our body fights and regenerates its strength. So, would you quickly just tell our audience, like, how many hours a person should sleep for a healthy life, and how does it differ with age?
So, for a normal individual who is not doing much activity, now your sleep also is determined by the amount of activity you have per day. Suppose you are somebody who has high intensity workout as a part of your routine, then you need to have 8 to 9 hours of sleep, because like I said, your body is inflamed after a workout and you need 8 to 9 hours of undisturbed sleep. But for an individual with lesser activity than the others, you need 7 hours of sleep. And of course, for children and infants, they need more hours of sleep as well, because it is important for their growth and development. They will need more than 7 hours of sleep.
if I
So, Dr. Rich, when people with diabetes, like they need to wake up maybe 2 times or 3 times during the night, so would that kind of interrupted sleep, is that okay for health?
no, if I can answer that question, the same question, I
Okay.
the same question, how many hours of sleep? It can vary from person to person. When you get up, you should feel fresh and you should feel prepared for the next day. So that is the most important point. You can sleep for 6 hours, 5.5 hours, 7 hours, 8 hours. So, but it all depends on how much sleep you get, and you should be refreshed. In diabetes, there's a condition called obstructive sleep apnea, OSA, where you snore and you sleep the next day. You feel very sleepy. Now, that's an abnormal condition. They sleep 8 hours, but they snore a lot, and next day they'll sleep again, especially after breakfast. And they'll hit the car against a tree, against people. So it is not the hours of sleep, it's a healthy sleep. And you should be refreshed when getting up. You should feel refreshed when getting up.
Right.
Your question about people with diabetes, people living with diabetes, getting up. If you are well controlled diabetes, you will not get up. You will sleep like a person who has a normal blood sugar. Now, if you're above 60, if you're a man, and if you're above 60, then you should rule out a prostate enlargement. You should examine your ultrasound for any prostate enlargement, and there are drugs to treat prostate. you can treat it. If you're a woman and having thing, you should look for residual bladder. That is, women have stasis of urine in their, they pass urine, but they can have urine stagnating in the bladder, urinary bladder of 100 ml or whatever. So they feel like going too often, so to the toilet. So the it is, the bottom line is, it is not, if you have well controlled diabetes, you will not get up. But if you have, if you get up to pass urine, it's either anxiety, you are thinking of something and getting up and drinking water and passing urine, or it could be prostate, or in women it will be a residual bladder. Three things you have to rule out.
I would like our audiences to send in their questions. I have received quite a few, but more than 50% is only one question, Dr. Vijay, and I think you'll have to repeat your answer in different ways. That is whether diabetes is completely reversible and you don't need any medicines, as many people have been claiming recently. Then somebody is asking, if is diabetes reversible? If not, why is it allowed to be advertised to mislead patients? And simply, people are straight away asking, can diabetes be reversed? I think you really have to emphasize.
So I think diabetes is you can achieve a state of remission. The American Diabetes Association, the European, the Canadian, the Indian Diabetic Association talks about a condition where you can be controlled without tablets. It's called remission of diabetes. There is no reversal of diabetes. Reversal of diabetes is not possible. So remission of disease is possible. Remission of diabetes is possible. You can get your beta cells to work. You can get your insulin to work better by doing regular exercise and so on, and controlling your diet. If you take too much of sweets every day and don't exercise, how can you expect your blood sugar to be normal? And how can you go off the tablets? You cannot. So there's no remission possible. So remission is possible. Remission, not reversal. Remission is possible by doing regular exercise and controlling your diet properly. You can go off tablets. But once your beta cell really gets hit after 10 years of diabetes, 8 years of diabetes, duration, then even remission is not possible, because we have to eat. We have to eat carbohydrates. As Indians, we have to eat carbohydrate. Now, why is it people advertising that? Don't ask me that question. You should ask the legal authorities or somebody else the question. Anybody in India can talk whatever they want in the newspaper or in the social media. It's their opinion. It's their opinion. It's not the opinion of an association. If an association like the Research Society for Study of Diabetes, which I am going to head next year, comes out with a statement that the reversal is possible, then you can believe it. But we will never say it, and we have never said it. The American Diabetic Association never said it. We are the largest organization in the world for diabetes care professionals. The diabetes treating doctors, the largest in the world is RSSDI, which I'm going to head next year. So we don't come out with statements like that. So you don't believe individuals, you believe associations, which make statements like Association of Physicians of India, the RSSDI are two organizations in India which come out with statements and with consensus and guidelines and so on. Thank you.
Mr. Padmanabhan Subramaniam is still asking that most people living with diabetes, they are not able to sleep well because of urination disturbance. So please tell how to overcome this.
Ms. Vaishnavi, I think you can answer that first question, then I'll answer.
I think if you want to talk about how you can sleep well without medications when you have diabetes, very blatantly put, they say don't drink too much water after 7 p.m. I don't know how scientific possible that is, or how true that can stand for most people. They say post 7 p.m., don't drink too much water. If you want to have 2 to 3 liters of water, which is what is generally advised, take it before 7 p.m. So maybe that will help. And sleep hygiene is extremely important. Most of us go to bed with our phones in our hand. We get up to our phones in our hand. So at least 2 hours before you go to sleep, ensure that you put the phone away. You put whatever work you have left with gadgets, you put it away, and then you go to bed. Journal before you go to sleep, not only from a mental health perspective, but also in terms of your physical health, what you eat that day, how much water you've had that day, what you did that day at work, and mentally how you're feeling can definitely be a part of it. And then you go to bed. Journaling is an extremely important exercise for us to gain an insight as to what our lives look like, because most of us don't have that insight at all. So these are some tips that I can give you. But if you need medications, if you have a comorbid condition that requires you to take medications, then definitely get a medication. But if it's not necessary, don't make medication the first solution to your problem. Try the other methods, and if they don't work, definitely you can use medications.
So you emphasize the importance, Ms. Vaishnavi, of sleep hygiene. So I think it's very important, sleep hygiene. You switch off your computer, stop listening to music, stop watching cricket matches by 8 o'clock, 9 o'clock, and be ready to sleep. Switch off the lights and be ready to sleep. Don't watch the cricket match and then go to bed immediately. You will not get sleep because the cricket match is so fascinating. And you either watch in the television or you watch here in the stadium. So that's number one. Number two, as I said, you rule out prostate enlargement. Prostate, you have to do an ultrasound. You have to do an ultrasound. Sometimes the median lobe, I'm speaking like a urologist. So there's a median lobe which is enlarged, which cannot be detected in the ultrasound. The urologist has to examine per rectum and detect the median lobe pressing on the bladder. So the prostate is a gland which is present on either sides of the urine bladder, and the median lobe presses on the bladder and makes you get up in the night. Why nocturnal urgency is there? I don't know. That you must ask a urologist. So, but people pass urine in the night more often. Third thing is, as I said, women, especially women, have either a descent of the uterus and they have residual urine. Their urine collects in the urine bladder. Each time they pass urine, they have 100 ml remaining, and that can lead to more. This can happen in men also. Not it can't happen in men, but in women it's a common cause. So especially the descent of the uterus or bladder, it's called prolapse. So it can lead to more urination during day or night especially. So you have to rule out pathological causes and rule out the physiological causes. So there are physiological causes and pathological causes. Thank you. Good question.
Mr. Dinesh Kumar is asking about people who work in the IT sector in different time zones, and their sleep patterns are also very erratic. So what impact would it have on their health, because they're all on the job?
Ms. Vaishnavi, you can answer.
Yeah. So when you're working in at night, at night you can it'll definitely impact our health, because our biological clock is not made in the manner in which we're supposed to sleep at night. And it's made in a manner where we have to sleep at night and work in the morning, but not all of us have the privilege of doing that. Some of us have to work at odd hours and at night. And I don't think your sleep can be completely restored in the morning, but you can have Naps can happen, but I don't know if they can go into this last stage of sleep that I told you about, deep sleep. I don't know if it is possible to attain deep sleep in the morning hours, but definitely naps and longer naps, not 10 to 20 minutes, but maybe 30 to 40 minutes, and then they can go about their day. So I think that will help definitely, but I don't think they can ever be able to attain the deep sleep that they get at night. Yeah.
If I can add one point to this, if lack of sleep will increase blood sugar because catecholamines, all the noradrenaline gets secreted if you don't sleep. So you should sleep. So if you have uncontrolled diabetes, you should walk up to your boss and say that I'm not getting sleep. So get me off the night shifts and give me day shifts. You can talk if you have uncontrolled diabetes. We doctors give letters of recommendation to take them off night duty. So if you have uncontrolled diabetes, you need to do that. Or if you can't do that, you sleep. Come back and sleep. You can sleep. You can ask your doctor some tablet to sleep in the initial. We give tablet for sleeping for 2 weeks, 1 week, 2 weeks. Beyond that, the medical shop insists on a prescription from the doctor. Gone are the days when you could walk into a medical shop and buy tablets for sleeping. No, it's not allowed. The government has banned it. So I think you need a prescription from a doctor to get sleeping tablets. But I give tablets for anxiety. I give tablets for sleep for limited periods, 1 week, 2 weeks. So you have to take tablets and sleep. So, but if you don't sleep, you are not going to get your diabetes under control. So if you want to be a healthier and happier you should sleep. You should sleep well.
Rohit Varun is asking about the chip to monitor GV, which is only valid for 14 days, he says, and it is also expensive. So, is there any other device that can be used for a longer duration once fixed?
So right now we do not have a CGM, continuous glucose monitoring system. We have only the one from a German company. So it comes for 14 days. The other things come, Dexcom comes lesser, 10 days and so on. So I think you will have to replace it's expensive. It's about 4,000 rupees, but it's expensive. But if you want to stop cooking your finger and do your blood sugar testing, you should fix a AGP or CGM. You should look at the cost.
These days, we also hear a lot about dementia cases on the rise. So, is memory loss a natural process as a person ages? And some related questions like, does multitasking have anything to do with memory loss, or are there any methods to improve memory without medication? Vaishnavi.
So, dementia. See, that's why early screening helps, right? We're doing the mini cog in order to tell you if there are any signs that you can look out for. And if we're able to diagnose it earlier on and make people aware, then that definitely helps. And in relation to multitasking, multitasking can affect our memory, but in what way? There is something called selective attention, which means there is something in front of you. You pay attention to every little detail of it and you selectively attend to it, and it moves to your short term memory. So that works best in all cases. And multitasking does the very opposite of that because you're focusing on two things at once and your brain is not able to comprehend what you're doing. You're not able to selectively attend to the stimulus, and that is causing issues. And therefore, multitasking is of absolutely no use. But some people do have to do it sometimes. If you have to do two things at once at your job, you can't say, no, I'm not going to do it. So during situations like that, of course, multitask, but only to the extent of which you can handle it, not to the extent that it goes above your head. So don't do multitasking to that level. And what was the third question? I'm sorry.
Mm,
No, there was no
I,
third.
no, it was just combined it with all
This,
memory. It was about multitasking and without medication, how you can improve your
I
memory.
yeah,
that he said,
Mm.
if you're a person with diabetes, person living with diabetes, especially if you're above the age of 60, then please rule out a vascular dementia, vascular cause. You have to do a carotid Doppler, that is looking the blood vessels going to the brain, or you can do a CT scan, and you can see vascular changes, blood vessel changes happening in the brain, which is very common in people with living with diabetes. So if you're speaking about dementia, these are correctable dementias, correct modifiable factors. So you can correct the dementia. The Alzheimer's disease is a non-modifiable. As of now, we do not have medicine to correct the Alzheimer's disease. So that is different. So that occurs in little elderly people who are 70, who lose their sensation in the memory, the brain slowly. Alzheimer's disease is non-modifiable. Modifiable is the vascular dementia. So I think you have to differentiate the two in people with diabetes. Thank you.
Does menopause affect memory?
Menopausal women do experience some changes in their memory, probably because they have hormonal changes. I think doctors can better explain that to you. But yeah, they do go through some changes in their memory because they're already going through a lot. So memory is a very active part of that as well. So they will see changes in their memory a
So
little bit.
if I can add little more than what she said, I think you have to look at vitamin D and vitamin B12. It's very common. Vitamin B12 deficiency is very common in people who are vegetarians because the source of good sources of B12 of the non-vegetarian food. So people who take vegetarian food when they reach menopause, you have to be very careful. Second thing is falls due to calcium deficiency are also very common. So once you fall and you have a fracture of the head, neck or femur, then you are depressed. So I think memory can be reduced in women during menopause, in men during andropause, if there is some reason for it. So you should find out the reason.
So I'll take a few quick questions on diet. Somebody's asking, is wheat-based food better than rice for diabetes? And does intermittent fasting, which is a fad these days, does it help people living with diabetes?
So there are two questions. The first question is
Wheat
I'll
or rice?
yeah, wheat or rice, both are carbohydrate, remember. So both can have increase in blood sugar. Some people talk about millets. It's also carbohydrate. So millets are carbohydrate, wheat is carbohydrate, rice is carbohydrate. What Professor Vishwanath showed in the 1950s, he said rice and wheat are the same. He did extensive research on rice and wheat, and he found both are equal, both are same. You can't ask a South Indian to take a person from Andhra Pradesh to take wheat, chapatis. You can ask him to take in the night, but not in the afternoon. He enjoys it, his meals, his rice. So I think you have to give people the food they eat, not the food. Don't force anything on them. So I think wheat and rice are the same. It's the wheat might contain more fiber, but if you're a rice eating person, eat rice. Why are you going to wheat? Number one. Number two, intermittent fasting. If you're taking tablets, please tell your doctor how to take how to do the intermittent. I'm not saying intermittent fasting is bad. Intermittent fasting is good for people who are pre-diabetic or not diabetic. But a person with diabetes who's taking insulin 3 times a day, 4 times a day, how can you do intermittent fasting? How will I adjust the how will I give him food? How will I not give him food for 18 hours? Then fasting is going on now. We do not allow. There are risk stratification. There are some people who should not fast. Those who are taking insulin 4 times a day should not fast. So Ramadan fasting is out of the question in some people who are taking insulin 4 times a day and so on. So intermittent fasting is not allowed for people who are taking multiple drugs, particularly those taking drugs which produce hypoglycemia, low blood sugar, drop in blood sugar. So please remember that. Otherwise, intermittent fasting is a very good concept. You eat for 6 hours and fast for 18 hours. It's good concept. But for people with diabetes who are taking drugs, I think you have to discuss with your physician.
Shankaran Yuvarajan wants to know, when does a person become insulin dependent? And there's also a related question, what are the blood sugar levels for diabetes to start taking medicine?
Yeah. So the concept, there are two questions here again. The first is the insulin. So there is a concept of glucose toxicity, where your beta cells are active. They produce insulin. They're capable of producing insulin. Duration is only 5 years. They're capable of producing insulin, but they do not produce insulin. They do not secrete insulin because of glucose toxicity. So we can give insulin for short term periods of 1 month, 2 months, 3 months, whatever, to make the beta cells recover. Insulin is never a death sentence, remember. So insulin is available as a pen now. Insulin has become available as a nasal spray now, or not a nasal spray, a mouth spray. It's been approved by the government of India. So I think it's going to come very soon. So I think we have finished the trials, we have submitted the data. So I think it is. Don't worry about insulin. Don't fear insulin. And we have fantastic insulins now, not like the olden days when we started practicing. So that is the first question. What is the second question? I forgot.
Does it also come as oral pill?
Yeah, insulin doesn't come as an oral pill, but we have semaglutide, which is a glucagon-like peptide receptor agonist, which is available as a tablet. It's a peptide pill. It escapes the gastric secretion and goes into the intestine and starts acting. GLP-1 receptor agonist. But insulin has not been manufactured till date as a tablet. No.
And is there any best time to take insulin? Can it be, somebody is asking, can it be taken late night if I'm returning from
It depends
work
on
very late?
type of insulin and blood sugar you have. Some people have fasting hyperglycemia. Fasting blood sugar is very high. We give them an ultra long-acting insulin analog in the night. So it all depends on when the blood sugar is high. You can know by the CGM, which is attached, or you do blood sugar testing, and you can that insulin that the physician has to decide which insulin is best for you. There are a plethora of insulins available, so you have to leave it to your physician. What was the second question? I forgot.
Second was, what are the blood sugar levels for diabetes to start taking medication?
You must remember gone are the days when we used to wait till the blood sugars go up. Because I showed you a diagram. The blood sugar starts going up, insulin resistance, secretion, at least 5 to 10 years before the person is diagnosed with diabetes. I showed you a slide. And I showed you a slide, also in the same slide I showed you, that complications of diabetes, micro and macrovascular complications, occur 5 to 10 years before diabetes. So what are we waiting for? We have wonderful drugs like the SGLT2 inhibitors. We have GLP-1 receptor agonists like semaglutide. So we start using it. It's in the guideline, and every diabetic is considered to is supposed to be a coronary artery disease equivalent, CAD equivalent. That is, he's got a heart attack. it is assumed that he has got a heart attack. So these are drugs which are good for the heart failure, kidney failure, liver, and so on, fatty liver, and so on. So you should start medicines even when you are a pre-diabetic. When you are having pre-diabetes and you detect blood sugars at a very early stage, you should start the medicines. Gone are the days when we used to wait for a number of years when diet control doesn't work and we start tablets and all that. So gone are those days.
So Harishankar is asking whether it is safe to take homeopathy alongside, because many times people feel allopathy has a lot of side effects. So is it okay to do alternative treatment like homeopathy?
Yeah, why not? We allow anypathies to allopathy. So we allow anypathies to allopathy. So homeopathy, Ayurveda, anything you want to take it, but keep your diabetes under control.
Um, Walking, you mentioned about walking as kind of a compulsory regime. So does the speed of walking matter, or does the time duration of walking matter?
Yeah, I'm supposed to answer the question. Okay, so you should walk. You should not talk to neighbors while walking. I see many people talking uh, about what they saw in the serial or they saw in the cricket match the previous night while they're walking. You shouldn't do that. Don't go for walking in that case. So walking is serious. Number one. Number two, you should cover at least 4 kilometers in 30 minutes. 4 kilometers, 5 kilometers in 30 minutes. So you should walk fast and you should walk with your hands moving,
Swinging.
swinging, and so on. So,
Okay.
uh,
Vaishnavi, maybe you could take this diet question. Bhaskaran Ramamurthy says, I'm taking bitter gourd juice and carrot pieces as a snack after breakfast. I am pre-diabetic. Is it advisable to take bitter gourd daily?
I mean, if he likes the taste of bitter gourd, nobody's gonna stop him. He can take it, but I don't. I don't really know if it has any benefits in reducing diabetes. If that's what I mean, reduction or reversible, but whether it makes it reversible, because a lot of people still believe that taking bitter gourd juice or particular type of fruit juice is going to help them reduce their diabetes. A lot of patients that I have seen, we're doing a study called DSMES, where we provide them the education and support that's necessary to manage their HbA1c levels. And I see most of them say that they take fruits as their breakfast, and because they think it's completely healthy. But no, it's actually going to increase your HbA1c levels, because fruits do have sugar in them and it is going to affect you. Don't have it on an empty stomach. Don't start your day with fruits. Have your meal, have a bit of protein, have a bit of carbs, and then maybe add a fruit. But don't take just the fruit and then assume it's the most healthiest meal of the day, because fruits, they do have a certain amount of sugar that's going to increase your blood sugar levels.
But I think it's still better to take sugar from natural resources, because somebody is also asking how much sugar is actually allowed to people living with diabetes.
so I think the American Diabetes Association has allowed 1 teaspoon per day, 5 grams. If you're a well-controlled person with diabetes with no obesity, if you're not obese, if your BMI is 23, 24, BMI body mass index, and you can take 1 teaspoon of sugar per day. That's allowed. It's not that people with diabetes should not take sugar at all. No, we allow, depending on the situation. If you allow somebody who's obese and uncontrolled diabetic to take sugar, he'll take it every day. He'll take it morning, afternoon, evening, night. He'll take it 4 times a day. So we will we will decide who can take sugar. Though the American Diabetes Association recommends 1 gram, we may not allow it in everybody. It's up to the physician to decide. So the physician will decide which patient will take how much sugar and whether we should allow the sugar. The dietitian and the diet counselor and the educator and the doctor, physician can decide.
If somebody is living with diabetes for many years, say more than 10 years, how frequently should that person go for a checkup?
Once a year is ideal. This was recommended by all associations all over the world. You should check your retina. You should check your brain, the blood flow to the brain. You should check your heart with an echo and ECG. You should check your kidneys. You should check your feet. So these are the checkups you should do it once a year. And check your lipid levels. LDL cholesterol should be kept below 70 in people who have diabetes. So I think this is to be done once a year. If you have complications, you should do it once in 6 months.
Venkateshwara Rao is asking Vaishnavi whether yoga and meditation will help in sleep, any kind of sleep disorder.
It'll definitely help there. So, in progressive muscle relaxation, like I mentioned earlier, it's a guided practice where you keep your eyes closed and you listen to the instructions that the psychologist gives you and you follow those instructions. And you're also given visual imagery. For example, they say, imagine you're in this place. And it is a form of meditation, of course. So, meditation practices definitely will help in sleep. But if you're having major sleep issues and you're waking up too often, then you're going to need medications.
And one quick point on keto diet. How far do you advise that? Keto diet. Yeah.
You're on mute.
There is a question, does sleep have any relationship with Alzheimer's? We still do not know what is the pathology of Alzheimer's disease. We know the pathology, but we don't know the etiology. What causes Alzheimer's disease? So you better sleep. Nobody is asking not to sleep. She told you how to sleep well without medicine. So you can sleep well. There's also one question about relationship between thyroid disease and diabetes. There is a strong association, and you're going to have a thyroid webinar, I think 2 days later or tomorrow. I think thyroid and diabetes is very much related. And hypothyroidism is more common, so you should check for TSH levels. Even if you don't check the T3 levels, you should measure the TSH levels in every person living with diabetes. So what is your question about keto diet? So keto diet, once again, is a very good diet, but we are used to carbohydrate from childhood. So from childhood, you should cut off carbohydrates. You should not allow the child to have any carbohydrate from childhood. You can't cut off when the person is 35 years, 40 years, 50 years old. So it's cruelty. It's a criminal act to cut off carbohydrates. We need carbohydrate. Our brain is used to carbohydrate. So you cannot live on protein and fat. So we need 60%, at least 50% carbs in our diet. So I think keto diet is not having a big durability, sustainability. So you can do it for 1 month, 30 days, 15 days, or 45 days. Or it's not sustainable simply because we Indians, according to Dr. Shashank Joshi's START study, the whole India takes 60%, 67% carbs. So how can you cut off carbs from keto diet in the keto diet? So it's criminal act to cut off carbohydrates. So keto diet is not recommended, especially in India.
So I think we are running out of time, and I'll just wrap up with one very basic question someone has been repeatedly asking. The person is saying that you are continuously talking about levels, but could you please specifically cite the blood sugar level or the HbA1c level where you call it to be pre-diabetic, diabetes, and then good control?
Okay. So if you want to call it pre-diabetes, you please do a glucose tolerance test in India, because the World Health Organization today has adopted what is called intermediate hyperglycemia, the 1 hour value above normal. So you please do a glucose tolerance test. And if your 1R value is more than 155, then you are a pre-diabetic, not the HbA1c. HbA1c among people in India is not very reliable. You have to do a glucose tolerance test. This has been shown by us several years now. So you have to do an oral glucose tolerance test. Number one. Number two, to call it good control, you look at HbA1c. Keep it below 6.5. But if you're above 70 years old, 80 years old, 70 years old, you can have up to 8 also. If you're above 70 or 80, if your lifespan is reduced, if you have advanced cancer, you can keep it at 8%. But otherwise, if you're a young, healthy individual, 6.5%. So HbA1c is good for monitoring, for looking at the monitoring as a monitoring tool. But to make a diagnosis, please don't do a HbA1c. Please do a glucose tolerance test, GTT, and look at the 1R value. You do a 3-sample GTT, not a 2-sample GTT. You do a 3-sample GTT and look at what is called intermediate hyperglycemia, 1R value above 155.
Right. So actually, there are lots of very reading specific questions, and I would leave that to you, doctor, for answering them directly because we have crossed our time limit. I'm sure all those who joined us for the webinar have gained some valuable inputs and will return with the motivation to renew their health journey. The takeaways are simple and easy to follow. Rethink, as Vaishnavi says, rethink your dinner plate, rethink your exercise regime, rethink your sleep pattern, rethink your lifestyle, because all of this will collectively ease you up and make you feel happy. And when you're happy, it strengthens your immune system, protects your heart, combats stress and diseases. So thank you once again, Dr. Vijay and Vaishnavi, for the enriching session on a healthier and a happier you that was brought to you by MV Diabetes under the Hindu Wellness
Thank you,
series.
Uma
Thank you so much.
who's a senior editor of the Hindu, and we have great respect for Hindu. And I think this webinar series is going to educate people, make them more aware, and we want all people with diabetes, living with diabetes, to have a healthier and happier you. Thank you very much.
Thank you so much. Thank you.
Thank you.